Hello, thank you for joining us. My name is Meg Beyer. I'm a social worker at the McSilver Institute at NYU, and I'm joined by my colleague Heather from New York State's DOH, who will introduce herself later. Today we're going to talk through some of the components of the Children's Health Home's training on complex trauma determination. Before we get started, I'm going to talk through some of our agenda and housekeeping items. The topics that we're going to cover on this portion of the webinar, we'll review the workflow, we'll review the licensed professionals who can complete the CTEA and determination form, and we'll also review the role of the health homes and care management agencies. In terms of housekeeping, just to remind everyone, none of the material in these webinars are new. This has all been pulled from the 3 in-person trainings that were offered in Albany, Rochester, and New York City this February. The material is as current as of the date of the recording, which is April 28th, 2017. So with that, I'm going to pass along to my colleague, Heather.
Hello. My name is Heather Allen, and I'm a member of the Health Home Serving Children team at the New York State Department of Health. The New York State Department of Health has partnered with the McSilver Institute at NYU to provide training and assistance to health homes, health home care management agencies, and licensed professionals on the complex trauma determination process. We are very excited about the approval of complex trauma in New York State as a single qualifying condition for health homes. The Department of Health, along with our state partners, worked with CMS to have trauma as part of the Health Home Serving Children's program, and CMS, along with their partners at SAMHSA, approved their definition of complex trauma. Therefore, the state of New York has complex trauma as a single qualifying condition for health homes serving children in our state plan amendment. New York State is the first and only state to have approval at this time for complex trauma as a single qualifying condition for the health home program. Having complex trauma as a single qualifying condition for health homes assists children who have experienced complex trauma and would not otherwise meet health home chronic condition eligibility gain access to health home care management services. Following the approval of complex trauma in the New York State Plan Amendment, the Department of Health convened a group of stakeholders with expertise in trauma and complex trauma to develop a process to implement the approved CMS SAMHSA complex trauma definition. As such, the stakeholder work group developed procedures and a workflow for documenting and assessing if a child meets health home complex trauma eligibility criteria. Today, we will have the opportunity to review the process for determining if a child meets eligibility for health home serving children with the complex trauma determination. This is a new process, and as implementation occurs, the Department of Health welcomes feedback from stakeholders on the complex trauma determination process for health home serving children. We want to be aware of what is working well and also of any barriers and challenges that health homes, care management agencies, and licensed professionals, as well as other stakeholders, find with the current process. Having your input is very important to us so that we can provide better assistance to address challenges and barriers. We want to make this process successful, and your role is key in ensuring that success. We will now review the process to determine health home complex trauma eligibility for health homes. Before I walk you through the workflow, I want to share there is a variety of forms with the complex trauma determination process, and some of these forms can be completed by a required list of approved licensed professionals. There are other forms that do not require access to licensed professionals. On this slide, some of those forms, all of those forms are referenced. The next two slides will outline the workflow and process of determining that a child meets eligibility for Children's Health Home under complex trauma. The distinction between these two workflow slides is that scenario 1 outlines that the referral is made by a non-licensed professional or a licensed professional that does not have access to the tools to make a referral to the health home program. Workflow scenario 2 illustrates if a licensed professional is already involved with the child and family and can make the referral to health homes and subsequently complete the necessary assessments to assist with the determination of complex trauma and for enrollment of the child in the health home program. This first slide provides a workflow for scenario 1, where there is a need identified by a non-licensed professional or licensed professional without access to the tools to refer a child for assessment of a complex trauma determination. We will use an example if the referral is coming from a social worker who works with a child, Joey, who they feel may be eligible for health homes under a complex trauma determination. The school social worker would first complete the complex trauma exposure screen. It's encouraged and will be later highlighted in this presentation that the school social worker or anyone completing the complex trauma exposure screen can do so without interviewing the child. The professional, an individual completing the CTS-ES, can utilize their own knowledge, experience, and records to complete the screen. You will see during the review of this tool that once you have identified 2 areas of positive domains, then the screen can be stopped and a referral can be made. If Joey's complex trauma exposure screen is positive, the school social worker would make a referral to their lead health home using the health home's community referral process. All health homes have developed a community referral process, and they are responsible for educating their network partners on this process. It should be noted that every health home may have a variant of their process. Providers should be aware of the health homes in their provider community. Many health homes have community referral forms that can be completed by their care management agencies, and processes for how to submit the referral to the health home. In this case, the school social worker would send the cover sheet, CTES, consent, and additional background information or supporting materials to the health home. If the referral is coming from someone who already has access to the MAP referral portal, such as a local Department of Social Services, managed care plan, or care management agency, then that referrer can make a referral in the MAP referral portal to the health home and also send documentation to the health home. The documentation that would be sent is noted above: the CTES, cover sheet, and any other additional supporting materials. After this, the health home would assign the child to a care management agency, and the care manager would work with the child and family to connect them with a licensed professional who can complete the CTEA and the functional impairment assessment from the NCTSN approved tools. These tools can be found on the NCTSN website. If the child is already connected to a licensed professional that can complete the CTEA and one of the NCTSN functional assessment tools, then the licensed professional determines if the child meets complex trauma eligibility through the completion of the complex trauma eligibility determination form. The licensed professional also needs to determine if the child has another eligibility condition. Even if the child is not eligible for health homes under a complex trauma determination, it may be eligible under another chronic condition. As already stated, the difference in this slide is if a licensed professional is the one that is identifying the need of the child and has access to the tools to make a complex trauma determination for health home eligibility. The licensed professional would first complete the complex trauma exposure assessment and one of the NCTSN approved functional impairment assessments with the child. This step may occur simultaneous to or in close proximity to the complex trauma exposure assessment if clinically appropriate. Please see the New York State Department of Health Guidelines on Complex Trauma Assessment Process excerpted from the NCTSN Complex Trauma Assessment Guidelines, as well as the NCTSN Complex Trauma Assessment web pages for guidance on best practice in the complex trauma assessment. If possible, the licensed professional should avoid redundant assessments. After the licensed professional has determined that a child has both exposure to complex trauma and a functional impairment, they would then complete the complex trauma eligibility determination form. If positive determination is made, the licensed professional would make a referral to a health home using the health home's community referral process, or if connected to a health home or care management agency, working with those agencies to make a referral. The health home would then assign the child to a care management agency, and a care manager would begin to work with the child and family. The care manager would then gather all documentation to verify complex trauma and any other child history and diagnoses to determine health home appropriateness and eligibility to enroll the child in a health home. It is possible that the care manager may determine at that time that the child has another diagnosis or a single qualifying condition that would make them otherwise eligible for health homes. Assessments and supporting documentation of the child's complex trauma and any other history of chronic conditions can be used to assist with the development of the plan of care. The care manager should ensure that all documentation is within the child's record that verifies both eligibility and appropriateness for health homes. This slide provides a list of Department of Health approved licensed professionals who can complete the Complex Trauma Exposure Assessment, the CTEA, and the NCTSN Functional Impairment Assessment, as well as determination form. Clinicians identified include, but are not limited to, employees of licensed, certified Article 28, 31, 32, and 16 clinics. Health homes and care management agencies should work to partner with licensed professionals and existing clinics to determine how these assessments can be billed for under existing assessment billing practices. Licensed professionals completing the CTEA and NCTSN functional impairment assessments should also be conflict-free. The care manager cannot be the licensed professional completing the assessments and eligibility determination for complex trauma. Professionals can be in the same agency, but not under the same supervisory structure or program. The purpose of this slide is to assist the care managers on the workflow if the referral is coming from their agency staff or an outside service provider. The health home and care management agencies have several roles in the complex trauma eligibility for health home determination process. If a health home and CMA is in contact with or working with a child who they feel may be eligible for health homes under complex trauma, they would first complete the complex trauma exposure screen, and referral cover sheet. They would then make a referral within the MAP Health Home Tracking System in an outreach segment. The health home and CMA would work with the child and family surrounding the health home program to connect the family with a licensed professional that can complete the CTEA and NCTSN functional assessment tools if there was a positive screen. The licensed professional would work with the family, as mentioned, to complete the assessments for determination as well as consideration towards treatment. If a referral is coming to a health home and care management agency from another service provider, the health home or CMA needs to obtain the referral from that service provider through their community referral process. The health home and CMA would need to begin an outreach segment in MAP and then contact the referral source to obtain the positive complex trauma exposure screen, referral cover sheet, and other family child history and information. Consent may be needed for information beyond the complex trauma exposure screen. The care manager would then work with the family surrounding the health home program to connect the family with a licensed professional that can complete the complex trauma exposure assessment and NCTSN functional assessment tools, as well as consideration towards treatment. Please note that in order to begin an outreach segment in MAP, there must be a positive complex trauma exposure screen. If there are any questions or concerns about this training and the complex trauma determination for health home process, the McSilver Institute Health Home Complex Trauma mailbox is shown here. McSilver Institute works very closely with the Department of Health to assist with assistance with any questions. As Meg already mentioned, we had in-person trainings on complex trauma determination, and we have received a number of questions from those trainings. On the Department of Health website also includes an FAQ on complex trauma determination, as well as the other forms needed to make a complex trauma determination for a child for health home eligibility. Thank you for joining us today for this webinar.
And thank you, Heather, for walking us through this material. Thanks, everyone.